welcome to Science Goes to the Movies. A look at the stories of science and how they change our culture. I'm Lisa Beth Kovets. In this special At Home with Lisa version of Science Goes to the Movies, we're going to skip the comparisons between fiction and sciences because, after all, we're now living in our own dystopian novel. So we're just going to try and bring you some good science facts about the situation we're in right now. Dr. Larry Wells, ER physician from Kaiser Permanente, is back to give us some insights on what's happening, what we should expect, and what's expected of us. Dr. Wells, hello and welcome back to the show. Thank you so much for taking some time to answer our questions.
You're very welcome, Lisa Beth. Thanks for having me.
Dr. Wells, the beginning of COVID-19 symptoms are very much the same as a cold or the flu. How do I know if I'm really sick?
Usually about a week after having, say, mild onset of disease, they progress into a second phase in which the disease can be overwhelming, and the main symptoms that we look for are fever, cough, and shortness of breath.
On an absolutely practical level, at what point should I call a doctor?
So what we are telling people is if you have mild symptoms, if you have a little fever, body ache, feel like you have a cold or flu, and you think you have COVID-19, we actually do not want you to come to the hospital. We want those that are developing signs of severe respiratory distress, high fever, terrible chest pain, and in general feel as if they are getting sicker. We want those people to come to the hospitals and emergency departments in order to be evaluated. We do not want the hospitals to be overwhelmed. And currently, we are being overwhelmed, and based on the epidemiology of this disease, it frankly is going to get worse.
Dr. Wells, should I keep away from hospitals and emergency rooms if I'm not COVID-19 sick?
Well, we never want to deny or limit the access to the emergency department. So again, you're going to have to use your judgment. If you have an obvious reason for which you feel you need to come to the emergency department, let's say you fall and you've broken your arm and you feel that you need to have it evaluated, by all means come to the emergency department. However, in this time of the pandemic and the public health crisis that we're in, we're asking people to really use your judgment. And if you feel that this is a problem, a medical problem, for which I can seek medical attention later and not go emergently and use the emergency department as your 24-hour walk-in clinic just to get checked out, please do not do that. And fortunately, here in Los Angeles, we've been seeing that. We've been seeing, in fact, if I'm not mistaken, anecdotally, throughout the nation, there's been a drop in non-COVID related emergency department cases. And the public does seem to be heeding our advice to please stay away from the emergency department if you have a true non-emergent medical issue.
Also because you don't want to be where the sick people are right now.
Exactly, that's another issue. You do not want to be exposed to the sick people.
Larry, let's talk a little bit about the practicalities of masks. I have a construction mask and the N99 mask, though it's 7 years old. Both of these masks are 7 years old. What's the difference between these and a surgical mask, and how do you make them work?
One issue that really should be discussed is that for the general public, it is not recommended that you actually use an N95. You have to be fit tested in order to maximize its utility. If you do not have a properly fitting N95 mask, you still have potential entries where the virus can get in. So it's been recommended, because of the issue of improper fitting and improper usage of something like a medical N95, that really masking with a surgical mask or a facial covering, and try to make certain that the cover of your face and the sides are not too open. Some masks are very open and they just hang. Something's better than nothing. So any type of barrier is better than nothing at all.
And I understand you're wearing masks in your home.
Being a hospital worker, I could potentially have an asymptomatic case. And therefore, we don't wear masks all the time around the house. But if we think we're going to be in close contact, I have actually given masks to my wife and daughter and myself. Now, bottom line, wear some type of protection. My mantra in the hospital and out of the hospital is assume everyone is positive. Don't take a risk. You wear some type of protective mask, be it surgical or even a cloth homemade mask, which are now becoming more and more popular. If you're going out into the public, you have to minimize your risk.
And what about gloves? What's your opinion on gloves right now?
Most people don't know how to use them properly. After touching a potentially contaminated surface, you should actually take those gloves off and discard them because they're potentially contaminated. COVID-19 is not transmitted through your skin. You're not trying to protect your skin. What you're trying to do is limit the potential exposure of COVID-19 into your respiratory passages. So as long as you're not touching your face, as long as you are discarding those gloves and utilizing them in the appropriate fashion, which most people do not do, gloves are protective, but really the recommendation is masking and washing your hands.
Larry, I understand that not all of the protective gear is so high tech in the ER these days.
Here is our current high-tech medical equipment that is being used.
What is that?
Basically, this is a paper bag. The coronavirus has been shown to survive in a porous cardboard or paper type bag for about 24 hours, whereas on other surfaces, plastic, stainless steel, it can last for as long as 3 days. So a lot of us, in order to help decrease the burden of the protective equipment shortage, we are recycling our masks, particularly N95s and other protective gear, by cleaning them, placing them in a paper bag, and not reusing them for at least 1 to 3 days, sometimes longer.
After the doctors and nurses who are on the front line of this war, it does seem like soap, just plain old soap, is the big hero of the situation. What is it about soap?
Well, Lisa Beth, soap is to the coronavirus as kryptonite is to Superman. But it isn't the magical properties of soap. It's actually science. Basically, what soap does is break down the membrane that's protecting the viral DNA, which is like a ball inside a greasy lipid bilayer that soap breaks down and will actually kill the virus. However, you have to wash your hands very thoroughly. You have to wash the surfaces. You have to get underneath your nails, in between your fingers. And you have to do it, it has been shown that you have to do it for at least 20 seconds. And that will allow that soap to attack that greasy protective wall and break it down. And it is much more effective than hand sanitizer. Everyone wants hand sanitizer. Hand sanitizer is being sold, I've seen, for hundreds of dollars, and it's being hoarded, but it isn't quite as effective as soap.
What is it about alcohol? And when we say alcohol, are we talking about my really good scotch, or is this a special kind of alcohol?
You basically need an alcohol content of at least 60%. And I don't think you'd want to use your good single malt scotch, particularly because it's not going to help. Although I have some single malts that are 62%. Vodka is probably 40%. Scotch is somewhere between 40 and 60%. And in the end, soap is the most effective way to attack that membrane.
In the movies, antidotes and vaccines happen so fast that they're practically magical. Why is it going to take so long to get a vaccine for this virus?
Well, relatively speaking, it's not taking that long because we've seen types of coronaviruses with previous pandemics, such as the SARS outbreak in 2004 and the MERS, Middle East Respiratory Syndrome, in 2012. We actually have a bit of a head start in determining exactly how to develop a vaccine. However, this is not an overnight process. Right now, there are numerous labs rushing to develop a vaccine, but it does take time. But fortunately, we have had a little bit of a head start.
Larry, as a doctor and as a father, are you frightened?
Yes, to some degree. I try to take my own personal fears and channel them into approaching this battle that we're faced with intelligence and science, as opposed to emotion, hearsay. And really, I think if we approach this epidemic, pandemic, this current scourge that we're facing with science and a good basis of scientific fact and knowledge, as opposed to mysticism and political rhetoric, I think that we will do just fine. But it is a fearful time in all of our lives.
Dr. Wells, as individuals, what can we do to help?
Really, the best thing that you can do is stay home and practice social distancing. Really and truly, the only way that you can transmit a virus is from person to person. And if you stay away from people, that's going to limit the major mode of transmission of this virus. So the first thing that you can do to help us out is to stay home and practice social distancing. Again, we're trying to flatten the curve. We're essentially trying to keep the hospitals from becoming overwhelmed right now. And unfortunately, hospitals are becoming overwhelmed in certain locations, particularly, unfortunately, like New York. So staying at home, practicing social distancing, looking out for your neighbors right now is really important. You may have some elderly neighbors, and keeping tabs on them, making sure that they're doing fine. And just not going out in public is really the biggest way to help combat this disease.
Dr. Wells, I know you're tired and I know you're working hard, and thank you so much for taking some time to clarify these things for us.
Really, it's my pleasure. I hope I was able to impart some idea out to the general public as what they can do to help us help them. And right now is a critical time, and I hope everyone stays safe, stay home, and we'll make it through.